Hey, everybody, and welcome back to another episode of Early Childhood Chats, the podcast. Andy Rozak with you as always. And today we're digging deeper into one of the most pressing challenges we have in early childhood. Oh my gosh, that gap between what programs really need when it comes to mental health support and, quite frankly, what's actually available to them. This is an issue that hasn't went away and probably has only gotten worse when we look at the recent history here. But we know the research is clear that infant and early childhood mental health is one of the most effective tools out there. But oftentimes our programs are struggling to figure out how to access consultants and get the professional help that they need. My guests today they're working hard to close that gap. We've got Dr. Neal Horen here with us, and also Shai Idelson from the Thrive Center. Is that right? The Thrive Center?
Right.
Yeah, Georgetown University. Let's say that. Everybody knows Georgetown University, but the Center for Child and Human Development, also the Center for Excellence for Infant and Early Childhood Mental Health Consultation. And these guys are well known, especially Neal. He's been out doing the circuit for many, many years now. I think you've been in all 50 states at this point, Neal, I would think.
Yeah.
But super excited to have you gentlemen on the podcast today and talk about all the challenges that we're seeing, because it's really impacting classrooms today as we're having the conversation. So let's toss over to Neal. Neal, say hi to folks, introduce yourself, tell them about your background, all the crazy stuff you've been up to.
Well, I appreciate that, Andy. It's good to be with you. And I like that we started with you and I just going back through all the good places you've been that I haven't been recently. But yes, I'm Dr. Neal Horen. I'm the Director of Infant and Early Childhood Development and Early Relational Health at the Thrive Center at Georgetown University. All the other things, Andy, that you talked about are centers that I've been able to run and we've worked on. Center of Excellence for Infant and Early Childhood Mental Health Consultation. You and I obviously know each other through our Head Start work, as I've co-directed the Head Start Center on health, behavioral health, and safety. And I've spent the last 30 years trying to build the supports in early childhood, particularly around early childhood mental health. And we're lucky at the Thrive Center at Georgetown that we really are focused a lot on innovation and what the field really needs. And hopefully we'll get into that in our conversation today. But one of the ways that we've done that is by bringing in folks that are not necessarily from our field, but have a much more global perspective on how you innovate. And so that's my partner here, Shai Idelson. Shai?
Yeah, hi, thank you. And thanks, Andy, for the opportunity. So, yeah, very different background than Neal here. I was part of the corporate machinery for a great many years. I was creating innovation studios for big brands like Unilever and inventing businesses and brands for these corporations to make more money. At some point in 2019, I was brought into a big social media platform to try and help them understand why they were causing so much damage to mental health, and more importantly, try and prevent some of that damage. I would say that was a defining moment of my second life and my second career, because I realized that the situation is far worse than what anyone has imagined, and that big tech is not coming to save us, and neither is the legislator. That took me to a venture studio in New York called Redesign Health, where I developed, built, and launched a pediatric healthcare company called Fort Health that integrates behavioral health into primary care. Of course, then after a while, you realize that within that model, where you're working, if we think about the MTSS, you're working on intensive individualized supports. Within that model funded by venture capital, there's 50.8% of the population of children that you will probably never get to impact in a real meaningful way. Of course, I'm talking about the 50.8% nationally who are covered by Medicaid. But that, through that company, I met Dr. Matt Beal, who directs the Thrive Center. He was our chief medical officer, and we knew him through the Childline Institute. And then slowly but surely, my interest and center of activity has shifted from doing the company to working with Georgetown until I joined as an innovation director to really look at equitable models that Georgetown has developed over the years and what problems can they solve in a way that is self-sustaining, so we don't have to rely on grants. So the work continues to fund itself. And frankly, and I'll give Matt and Jason Lembeck, who is another partner at Thrive Center, tremendous amount of credit for having the vision to say, just because we are at a university doesn't mean that we need to move at the pace of the university. We could move much, much faster. So we have set up a venture studio that enables us to create structures that move at a greater pace, deliver more impact quicker. So
Wow, that
this
is
will be
actually pretty
this will be
innovative, right?
good.
It's everybody always critiques the universities at the high overhead and the slow pace and all that. So it's exciting to see that you guys have got this going on right here in my backyard over in Georgetown. That's exciting
Mhm.
stuff. So,
Absolutely.
Neal, I don't have all the data. I'm sure you have it much better than I do, but I do know that the percentage and the rate at which preschoolers are getting expelled, it's troubling to say the least, right? Um, I saw one fact that 250 preschoolers a day get expelled. Now, I don't know. You probably know better data than I do. It seemed a little bit high to me, but it's definitely higher than what we're seeing at K through 12. And I'm just kind of curious from your vantage point, what are some of the challenging behaviors and pressure points, and what are you seeing out there in the field? It's certainly changed over the last, what, 4 or 5 years, I would think, after COVID.
Yeah, no, Andy, I hate to tell you, but I think the numbers are right and may
Wow.
even be an underestimate given that we know that there's softer ways to expel and suspend children. We know in our Head Start work that you're not allowed to. I don't know that that prevents it from happening, but hopefully in Head Start we have that. In early care and education, it's much more challenging on both directions, quite frankly, in the sense of if I'm a childcare provider, my income is dependent upon having children enrolled in my program. And yet, if I have to spend an inordinate amount of time trying to figure out how to deal with a behavioral challenge, it may not be worth the time and effort. And so that number that you quoted, we started a long time ago. Walter Gilliam did great research that showed that 3 times higher rates in early care and education of expulsion versus K-12. That number, based on the work that Shai and I and others at Georgetown have been doing, has not shifted. And in fact,
Wow.
is to your point around COVID, COVID certainly exacerbated it. And actually, we saw more research, and Walter did some more good work where he showed a third of that early care and education workforce left, the great resignation. And so part of that continues because of what we're seeing in those settings where children are exhibiting the same levels, if not more challenging behaviors. What we've heard in our focus groups that Shai has led, in our interviews and things like that, is that the behaviors have become more challenging. We have people going to the hospital from injuries sustained in an early care and education setting, which, Andy, you and I have been doing this for a long time. That is not what we would expect in those kinds of settings. And part of what's happened is we're much more aware of some of the trauma that's going on. We're aware of the impact of all kinds of social determinants of health and things like that. And we know that what's happening is that not only are there more challenging behaviors, but we don't have staff. We are losing staff. Retention is a huge issue in the early care and education field. And we are losing people who even have the best experience. I was just on a call this week in which somebody said, I have somebody who is a really experienced early care and education teacher. They are doing the pyramid model, one of these great frameworks that we have, 99% fidelity. They are implementing the pyramid model, which you would think would help. They're quitting. They've had enough.
Yeah.
The injury that they saw, those kinds of things continue to exacerbate the problem that exists, which is people need support. They need support like mental health consultation, which I hope we'll talk a little bit about today. So I love the question. I hate the answer in some ways because it
Yeah.
suggests we're not addressing an issue that has been something. I've been doing this for 30 years. I was working on challenging behaviors at a Head Start in Washington, D.C. in 1998. And that I know belies how good looking I am and how youthful I look. But I've been doing this a long time. We keep hearing the same thing.
Well, and it's very rare. I mean, I've got the privilege of being in programs pretty much every week, and it's very rare I don't hear at least one or two stories about, oh my gosh, I'm being kicked, I'm being punched, I'm being bit, I'm being whatever. Um, Gosh, I was in Kansas City not too long ago, and one of the teachers came in with this massive boot on her foot, and I go, "What in the world happened to you?" She goes, "Oh, one of these kids, they kept hitting me with those big wooden blocks in the classroom, and now I get this cast on for the next 8 weeks." And I don't know. I mean, I guess this stuff has always kind of happened before, but I guess the severity and the frequency that we're seeing now is kind of new, right?
Yeah,
We've heard in our research that severity has increased, the frequency has increased, the ability of the caregivers around the child to be a bigger part of the solution has decreased. That's another factor. I think even the term challenging behaviors is being challenged in both directions. I've
Yeah,
had
yeah,
someone from a Head Start association in the state of Middle America tell me, I don't even want you to use that word. This is about safety. I got people bleeding. I got people going to hospital. That word undersells just how severe things are. And pay is not great. These are good people, right, doing good work, not getting paid great. Um, but they have heart for it. But at some point, challenging behaviors becomes the number one reason that they leave, right? Because they say, I don't need this, and you'll complete whatever word comes after that for that money. In
right.
fact, you can pay me double. I'm still not going to be enough for what I have to deal with.
Yeah. Well, it's interesting. California passed a new law, I guess not so new anymore, but 2 years ago on workplace violence. And as part of that, like now you're required to have this workplace violence log and all these things. And one of the questions, and it's actually still on their website, any of this behavior counts as workplace violence, and you have to document it and log it, and Cal OSHA will come out and audit you and all this stuff. And it did get quite a bit of pushback from the field saying, gosh, I don't want to keep writing this kid's name down on this log when these are typical childhood behaviors. But to your point, like, no, if you're sending people to hospital and bleeding and not really typical behaviors, and you can see from a kind of workplace violence or even a workplace comp, a workman's comp standpoint, like, yeah, these do cross the line from time to time. And what I'm also hearing, quite frankly, is the phrase, we have a new breed of parent that's out there. And I don't know how much that contributes to it, but if you think about like when we were kids, if my parents came to pick me up and the teacher would say, Andy was bad, or we've been working on A, B, or C, or Andy did this today, my parents would be like, oh my gosh, thank you, teacher. And we'll go home and we'll work on that. Or, what do you recommend? Or what can we do at home to, help continue what you're teaching or to make it better at home? Whereas you hear time and time again, you have that conversation at pickup, and the parents are like, well, he doesn't do that at home. What are you doing wrong? And it kind of turns the tables on the teacher, which again, we talk about recruitment, retention, and job satisfaction. Like, that's not, you've had a tough day with the kid, and now you're having a tough time with the parents. They're not even like, I don't know, believing you, or they're turning it down to make it like you did something wrong when you're just trying to do the right thing and help, right?
Yeah, well, first of all, it's unbelievable that there would ever be a time in your life, Andy, where somebody was complaining about your behavior as a young child. But I think part of what you're describing is if we spend most of our time figuring out who's to blame, it's the child, it's the parent, it's the teacher, what we're doing is we're losing the fact that what works well is when everybody's attuned, right? When the staff is sort of in sync with parents, when the staff is in tune with the child, that's what mental health consultation is, right? It's helping the teachers, the staff really understand, how do I work on this relationship that I have with this child and with this family so that it supports that child's social emotional development. I think what you're describing is that, and I'm not sure if it's new or if it's just been exacerbated by the stressors that exist right now for many families and for staff, to Shai's point about pay and working conditions and things like that. But part of what I think I've always pushed, our center's always pushed, the field has always pushed, is how do we help people work together, be in sync, be attuned, and know that we're all working towards the same thing. No family comes in and goes, God, I hope you really mess up my child's development.
Right.
No staff comes in and says, God, I hope you're as difficult as possible and get in my way. Everybody wants to be working together. We have to figure out what gets in the way and help support that everybody gets to do the things and works towards that child's thriving and flourishing. So I think your point's well taken, and I think there are ways in which to get at that, including things like the mental health supports of consultation.
So can we talk a little bit about the consultation? Because I mean, the data is very clear. Like, this is a great intervention. It's one of the most effective tools that's out there. But, it seems like we can't access the consultants. We don't know where they're at. We can't get on the schedule. Like, what's going on in the consultant world that this has become such an issue, Neal?
Well, I would answer, but I think Shai has done such great work on sort of field research around this that I'm going to let him, and I'll jump in, but Shai, why don't you sort of lay out what you've found in these hundreds and hundreds of discussions?
Yeah, so we did a national scan over 31 states on the state of challenging behaviors and consultation. And the best way for us to summarize it is that there are three doors that lead to three places that you don't want to be in, but that's exactly where programs find themselves in. Um, Door number one is I don't know what necessarily consultation competency is, so I'm going to over-index on quality. I'm going to pick an LCSW that takes $150 an hour plus because I know that they are at least licensed. I'm going to probably demand that they have some experience treating young kids, and I'm going to bring them in. The challenge is that, except for the very few, I'm going to miss on dosage because I can't afford to have them show up once a week for classroom observation. So door number one, over-index on quality. With the license as a heuristic, I'm missing on dosage. Door number two is I'm just going to take whoever is walking in through the door. If you say you're a consultant, like we always joke, like I am not a clinician, right? I'm a business innovation guy. By now, I've spoken with Neal and people like Julia Sales and Lauren Biz so often in programs. So I could probably walk into a center now and frankly BS my way through consultation. I'll be completely ineffective, but I can do it, right? So door number two, you miss on quality because you take whoever is in through the door, and we're not being judgmental. These people, program directors, education managers, they have a lot to deal with. So if they can smell help, they'll take it. Door number three is you just throw your hands up and you give up and you miss the whole point and you miss the impact, right? You just give up and you hope that no one's going to come check your performance standard or you're a 65-year-old psychiatrist. Nothing wrong with that, but that's not consultation. Now, what's common to all of these doors, right? The diagnosis that stands behind all of them is the fact that nobody has clearly defined what is the standard of competence for consultation and how do you, as a busy program director or frankly, sometimes funder, how do you evaluate if someone meets that standard? There's no classification for a consultant in the Bureau of Labor Statistics, right? It's easier to actually figure out how many taxi drivers there are than how many consultants there are, and you could throw Uber into that.
Yeah.
Um, so,
Huh.
so that is the diagnosis that we have found by talking and surveying hundreds and hundreds of people, and we have a lot of empathy for them because they want, especially in the Head Start setting, they want consultation. They understand its impact. It's just that the workforce and the definition of the competency isn't there.
Well, and it's sad. Like you said, it plays out time and time again. And you think about some of these directors, leaders that, I mean, gosh, they're being pushed and pulled in every direction. You don't have unlimited time to sit and research and make phone calls and do all the things, right? And then, yeah, I guess I never thought about the three doors, but yeah, none of those are really three doors you want to necessarily go through, right? So talk a little bit about you guys have got a pretty cool solution here. You got some new stuff coming out. What are you doing to help address this gap that's existing in the field right now?
Why don't you go ahead and talk about the competencies and kind of define them, and then we'll flow from there.
I just want to make clear that, Head Start has a standard, and you are required to have a licensed mental health person as your mental health consultant. If you don't, you can use behavior specialists and other sorts of categories who then are supervised. That is great, and there's a lot of variability in that. In early care and education more broadly, it's not required. We know we have great outcome data on how a mental health consultant can be helpful in childcare, and all that data points to it does all the things that we'd like it to do. We know it reduces those behaviors. It increases the classroom, it improves the classroom environment. It allows you to implement things like shameless plug, pyramid model, or conscious discipline kinds of things. And we know that people can't find those folks. And we've been waiting 25 years to find a bunch of mental health licensed people. I don't understand. Are we just going to keep waiting? I know we have lots of good training programs. We have them other places across the country. It's from my perspective, it's time to try and figure out alternative ways to provide the supports that will allow teachers to feel like I can do my job. I don't have to be concerned with the California OSHA requirements because I'm supposed to be focused on 18 children and their families. That's what we want people to be able to do. So, what we've been doing at Thrive at Georgetown is really thinking about where is the field and how can we get them to a place where more people have access to these supports, not just in Head Start where it's required, but more broadly in early care and education, and in fact, more broadly to anybody who's working with children. It could be in the child welfare system and in the early intervention system. We're obviously focused on early care and education, but the broader system needs the same support. So I don't know, Shai, if you want to talk a little bit more directly about some of what we're doing.
Yeah, so what we're building is number one, defining the standard of competence in very clear ways as the home for the Center of Excellence in Consultation since 2019, and people like Neal and team have been doing this for a very long time. I think we have the data and the experience to do that. So that's number one. But a standard of competence is only helpful if you have accessible, affordable ways to attain it. So that's what we're building. We are building a practical training program in infant early childhood mental health consultation. The program will take 4 months instead of 9 to 18 months. The program will be priced normally at $3,000, but now it's even less than that because we still have wet paint on the wall and we're still kind of renovating. So now it's gonna be $2,500. The critical thing about it, like we've done research and we've identified gaps, and essentially we're not that smart. So we just listen to what people tell us that they need, and then we go out and we figure out how to build it for them. So people told us, hey, it's great that there are certificates and training, but guess what? We need ongoing support. We need ongoing supervision. We need ongoing professional development. So the program itself is 4 months, but included in the price of tuition, we're baking in 8 additional months of group supervision and professional development. So we don't just foist consultants onto the field unsupervised and hope for the best. So that is the basic broad brushstrokes of what we're building. Now, to Neal's point, the key innovation, and again, we're not that smart. We listen to people and we respond. And I'll give credit to folks like Tracy Duarte from Pennsylvania, Patty Purcell from New York, Mark Douglas from Montana, and all of the wonderful grantees, Donna Ems from Illinois, and the wonderful grantees that they have connected us with. The message we heard was loud and clear. We are done waiting for more people to show up and help us. We want to build our internal capacity. Can you help us do that in a way that is compliant with the performance standards, in a way that will not see us have teachers running through the door to become consultants, and in a way that will deliver effective consultation? So that's what we're doing. We are opening a pathway for folks from early education backgrounds to become early educational backgrounds to become consultants. That's what the field wanted, and boy, am I glad that we listened, because as we look at the data now, 3 out of 4 people who have signed up for our first cohort in June are coming from that background. So the field is voting with action, not just with words. And I think the biggest lesson for us has been people have the wisdom in their own healing. People who are in the trenches. I'm going to quote another Head Start Co-op director who I hope is listening. People who have smelled the blood and carried the trash know what they need. So everyone that develops solutions needs to stop, come into NHSA with a table and say, guys, we figured it out. No, you got to be in the trenches and listen and give people what they want. And if you do that, first of all, they will appreciate the fact that you listen. And second of all, you're probably going to do okay. So
that's great. I mean, I love the field-based approach. It's really, for the field, by the field, because of the field, right? I mean, that's the way it needs to be. And so talk about if you're listening, you're interested, are there prerequisites? What kind of person would be able to come into the cohort? Like what are the gatekeeping qualifications to get involved with the program here?
Yeah, so we have obviously a pathway for, let's call it the traditional pathway. So we're talking about people who are licensed or license eligible, and we welcome them, of course. Anybody that wants to join this important field is more than welcome, and we will train them. And if the last time you saw a baby was when you were a baby, that's okay. We're going to help you understand, what it's like and have, to be in those settings. And then for the early childhood educators, we are looking for people, again, who have, to use that same quote, smelled the blood, carried the trash, who have been in these programs. I'll give you some stories of some of the people we have. We have a disabilities coordinator who's been with the same Head Start program for 17 years. She has a GED. She's one of the most incredible, thoughtful, knowledgeable people about anything early childhood. Her heart is in the work, but she wants to do more. Okay, she's coming, she's joining. Her program director enrolled her, and we are proud to have someone like that. We have a pyramid coach from a state who I will not name, but they know who they are. And basically, she's coming to test to see if being trained as a consultant as well could strengthen pyramid model implementation to fidelity. We have education managers, we have coaches, we have, of course, every variety of behavioral health aid looking to build consultative capacity. We've got folks from tribal communities. We have state Department of Health. So it's
Wow.
really all over the place in the best way possible.
Yeah.
And we welcome the diversity of experiences and backgrounds. And one of the things that we're doing is we are going to be putting people together who come from similar settings, but very different backgrounds in our classrooms, so we can cross-pollinate. We want to create a community there. But yeah, early, if you have a degree in early childhood education and a few years in the field, you're welcome. Again, if you have a GED and you've been in the trenches, you're more than welcome. For some people, when there's a little bit of doubt, they're not sure which pathway to go, hey, we'll have a conversation. You'll speak with one of our instructors and we'll figure it out. Georgetown, as a university, as you know, every higher education institute is very selective. This is not the point here. We are not trying to be a Birkin bag of classes. We're trying to be maximally inclusive because, everybody knows we need that capacity. And we're trying to be affordable as well.
Yeah,
Wow.
I was with you until you said Birkin. I don't know what a Birkin bag is, but it
I know
sounds.
Birkenstocks. Is that the same
Yeah.
thing? Or?
So, but
It sounds expensive.
it just reinforces when he called me and himself when he said that he and I were not very smart. I think the one thing that I would add to all of that is, I think some people want to push back and be like, well, that person can't be a consultant. So one thing that, and I know we've emphasized this and I'll continue to say it, this is competency based. We have a set of national competencies that the feds worked on with us. Multiple federal agencies worked. We developed those competencies. The entire work is predicated on how can we ensure that you're ready day one? Well, one way I can ensure it is I have a self-assessment on your competencies that you will complete. So we'll identify that person that Shai described who has lots of classroom experience probably meets competencies that somebody else might not. And there'll be spaces in which they're like, I really need to work on this. So they will get the course content. They'll have weekly reflective supervision. And there'll be additional things that they can go to if they're like, I still don't feel as confident about concepts in infant mental health. Okay, we have more for you to do. We're not just going to say, click on a bunch of asynchronous learning, meet with us once a week and you're ready. We're going to ensure that you're ready by making sure that you're filling out self-assessment, meeting with people live, working on actual what would happen if, and then going back and doing that self-assessment so you can say, I do meet those competencies. That's the most important part. Is to Shai's three-door problem is we have people meet the competencies, but they show up once a year to do an observation, or they're not accessible to folks in childcare who can't afford it.
Yeah.
Those three-door problems are massive problems. We're trying to help solve that by ensuring that there's a larger workforce, which we hear over and over again, and ensuring that not only are there more people, but they actually are competent and know what they're doing.
Well, that's phenomenal. So it sounds like a real mix of well, not in person, but like live via Zoom, webinar, live classes, asynchronous, on-demand kind of work, self-study that you can do at home, and it sounds like really the power, in addition to obviously the great instructors and the curriculum you're putting together, but the power of the cohort sounds like it's going to be really strong too. I mean, meeting people from all over the country and different backgrounds. So what a great program you guys. How's the turnout's been? Pretty good. The interest in the field, I can imagine, is probably off the charts.
Yeah, so we started, we've been in market for a while, talking to people and learning from them and basically co-designing the program with the field. And then at some point we flipped the switch and said, okay, we're open, everybody welcome. And we thought we would have 250 people as an initial cohort. Again, there's some wet paint on the wall. As of right now, so we're sitting here April 24, we're looking at 256 people who said they want to join. And we sort of had to have a difficult conversation also with our team, say, okay, are we going to open this a bit more? Because, we got, states coming in saying, hey, reserve some spots for me. I'm almost secured my funding. We don't want to exclude, but at the same time, there's no infinite space. So interest has been supremely strong.
Yeah.
We've just opened 30 more seats for a total of 280. And we are also starting to plan programs in October and in February 2027. So, like my kids like to say, we're out here. We're not going anywhere. This is not a one-time thing. This is going to keep going. And we would welcome anybody that is thinking about piloting this, building capacity internally. If you can't join us now, join us later, join us next year. We're here. We're
That's
here.
super
And
cool.
we're very, very flattered by the interest.
It takes me back in my prior life as a firefighter paramedic. We had these discussions, gosh, 20, 30 years ago about, enhancing what paramedics can do and extensions of physicians and trying to serve rural and frontier areas that didn't have healthcare infrastructure. And, you saw some of that with kind of like the bridge to nurse practitioner paramedic programs and stuff out there. But it was really a similar effort to try to just help the communities and say, hey, I'm sorry, we're not going to have the world's best, we're not going to have, what's the guy's name? Doogie Howser, the best physician in the world, move to rural Montana and help out our community. So what are we going to do, guys? We can't just sit and wait. And I appreciate the creativity that you guys are doing with this program too. Again, not something you typically see from universities. So I don't know what kind of mountains you had to move. I'm sure there were many, but kudos for getting this so far along. It's got to be exciting to be part of this.
Yeah, I think, I've been at Georgetown for almost 30 years. This is the only job I've had. So either I'm really good or they're just embarrassed to let me go. But it is, as Shai mentioned earlier, that we have to we're operating in a new way, not just as a university, but I think as a field to start to think about, you mentioned Montana. I've been working with folks in Montana for a long time. I've worked, as you said, I've worked in every state, and in places, Montana's a great example. Montana is unbelievably interested in building their mental health consultation, and they have. It also, though, is much more challenging to find 100 mental health consultants in Montana than it is in, say, Evelyn Blank in New York City has done some amazing work. In New York City, you probably could find 100 people who you could get. You could do some training, which folks get great training in New York City. But in Montana, there's great leadership around, we want to do this. How do we do it? Here's one way that we think is very helpful, which is to say, let's expand our field of vision. Let's open the aperture, as my friend Matt likes to say, and really think about what is it that we want people to do. We want people to be of support in our field. We've made it narrow, rightfully so, because we think from an aspirational standpoint, and we believe, very frankly, if we could find those people, having mental health background, having a license, certainly gives you a leg up, theoretically. From an aspirational standpoint, it would be great. From a reality standpoint, how am I going to serve people across the country who are in rural and frontier areas, who are in tribal nations where they're trying to continue to do this in a way that is consistent from a cultural perspective as well? How are we going to do this? We're going to open the aperture. We're going to make sure that we keep true to what it is that we need the people to do. And we're going to say, let's expand that workforce in a way that makes sense and ensures the competency, which for the last 25 years, we've had a much smaller pool. So to your point, Andy, we want more people in the pool because there's a lot of need.
Yeah. And I got to apologize. I'm a little bit naive. I mean, I know how Head Start works and accesses these services. If I'm the family provider, if I'm a center director, private pay type situation, how am I normally accessing these kind of resources? Is this something the state helps me with, our childcare resource and referral networks? Is this something that the state helps pay for? I'm just not sure how the mechanics of all that work, to be very honest with you.
It varies state to state, and that's why this national scan of mental health consultation that we just did, and there's information on the Center of Excellence website about 31 of the 50 states that have sort of verified their information. But in some states, there's a statewide program of mental health consultation, and folks in childcare are able to access it. It definitely is not something where I would point to a place and say they cover every single person, no matter what, it's free. But there are examples across the country where childcare does have good access, and programs in Arizona and Michigan and other places across the country have been doing this for quite some time. It is not a mandated piece of the work in childcare, and so it becomes a little bit more challenging. That said, that's the other piece of what we're trying to do is say, we're super interested, obviously, in our Head Start friends. It's a tremendous piece of the work that we've been doing at Georgetown. we've also been just as interested in the larger early childhood system and improving access, because in some ways it's even more critical there in a family childcare where you're trying to do everything, comprehensive programming, addressing all aspects of development. Having access to a mental health consultant can be extremely helpful in, one, growing your ability to do those things, and two, ensuring that you're meeting the needs of the children and families that you're providing care for.
Well, and I know you've been doing a tremendous amount of great webinars and putting out toolkits and all sorts of wonderful resources. Those are all free opportunities. And if folks haven't checked out the awesome stuff you've been doing, and gosh, the cadence has been, I mean, I think it's almost every month. I think I've been seeing stuff, right? So do you want to talk a little bit about the webinar series that you all have been up to?
Yeah, so our whole approach to this is we're trying to be of service, right? We're listening and we're trying to design things and we're trying to be of service. So we very quickly understood that to really maximize the reach and impact of our work, we have to start by giving people practical daily tools that they can implement tomorrow, posters that they can print out, thought tools, expertise, practical things. So we just said, again, there's no funding for this. RFK is not giving us anything for this. Neither is any state. We just decided we're going to do it, trying to be a bit entrepreneurial here. And we started and we said, we're gonna commit for 6 months and let's see who shows up. And again, my God, I'm happy we tried because over 1,400 people showed up for the first one in March, which was sort of the overview on the toolkit for challenging behaviors. As we sit here now, over 2,600 people registered for the session that we have on April 29th on co-regulation. And we're hoping to keep growing and growing. And for every person that shows up, 2 or 3 people ask for a recording or for the slides and we're full transparency. You want the slides, you'll get the slides. You want our posters, you'll get a poster. Somebody emailed us says, "Hey, your posters have too much colors. You're finishing my ink in my printers." Okay, thank you for that feedback. Now we're gonna have black and white with almost no color on them. So you get to retain more of your ink. And we have, I think, the unique thing about our program. Typically, you will have experts doing something over here. And then maybe you'll have people from the field doing something in a completely different setting. We have in each of our sessions, we are marrying together our experts, our faculty, people who have been doing this work and technical assistants for a long time, with people who are right now in programs. So, for example, on April 29th, we'll have Julia Sales and Kelly McDermott, who I'm sure a lot of people from your audience know, and they're going to be paired up with a program in North Carolina, who have built really over the last 15 years an incredible system of supports. It's not just consultation, it's not just pyramid, it's not just referrals, it's everything. And it's incredibly inspiring to hear them talk about the routines that they do on a daily basis and all the way to system design. So every month we're going to be doing that. And really it's about giving the field practical tools and not just theory, and letting the field hear from others who have tried things. And it's not all going to be success stories and glory. Well, we're going to have programs showing up and tell us we tried these 5 things and all 5 have failed, but here's what we've learned. And it's trying to normalize that conversation in co-learning.
That's amazing. And thank you for doing that. I know it's exciting to hear the success, and I'm sure hopefully we can extend the reach even further and get to people that may not have seen the offerings, because it's phenomenal and they're great sessions. Neal, I want to pick your brain a minute. Like if we've got a director that's listening, struggling every day with a child and doesn't know where to turn and being frustrated and like, look, we don't want you to leave the field. We want you to stick in our field. What advice would you have? What are things that, directors or teachers could kind of do today to help maybe have a little bit of a bridge or a Band-Aid until they can get some, professional help?
It's good. I like that, Andy. I think that, I go back oftentimes to my life at Georgetown, and Georgetown has a motto, cura personalis. Cura personalis is care for the whole person. And it's this idea that we need to pay attention to sort of all aspects, mind, body, spirit. And one of the things that I've learned in the work, and you and I have done this work together in after emergencies and disasters, is that often people don't take care of themselves. And so my first piece of advice would be to pause for a second and ask yourself, what am I doing for myself so that I can be available to respond to what's going on? Just a small pause. Sometimes I think I've been in your session when you've done something like that. Take 30 seconds. And we ask people to take 30 seconds. 30 seconds feels really long for people.
Yeah.
I'd encourage that director to take 30 seconds to say, what is it that I'm really trying to do? And then, what can I do? What's in my control? How do I address? Is it a staff wellness issue? Is it about safety, right? And sort of a hierarchy of needs and things like that. And if folks are able to do that, what they start to do is see the things that they can address in small ways, can address over a longer term, have more vision around the things that I don't have control about that. And here's what I still can do about the things that I control. And I just think that what happens oftentimes is this work is overwhelming. My mom was a pre-K and kindergarten teacher in the New York City public schools for 30 something years. And it was exhausting. I didn't understand why she would come home and lay down on the couch at 4:30. And I was like, what's wrong with her? And now I truly, after spending 30 years in early care and education world, I don't know how she made it home. This is hard work. And so the answer to that question is acknowledge that it's hard work. Acknowledge that you're not going to figure it all out just simply by saying, I need to figure it out. And I've done this with folks, and you've done this with folks after a disaster where they feel like I need to have all the answers. What you need is to acknowledge that you don't have all the answers, and that if you can start to figure out which ones are answerable quickly, answer them. Which ones will take a little bit more thought, planning, teamwork, all those kinds of things, figure out more of that plan. And that is why I think when we do this work, when we think about free things and things that cost money, we're doing it because we know that people need some answers. And to that director, what I would say is, you're doing good work. Acknowledge the good work that you're doing, acknowledge the challenge that's in front of you, and do something. Don't just, right? You can stand there for 30 seconds and then you can move. But the standing there for 30 seconds is oftentimes something that people skip and then are very frustrated that they can't figure it all out. So I don't know if that gets at what you were asking, and I hope so.
Yeah, no, 100%. I mean, that's like you take the job home with you, and it builds and builds. And I like that a lot. You got to realize what you can control and what you can't. And there is a thing that's real. It's called compassion fatigue, right? When you kind of take on all the burdens of everyone around you, and it's a real thing. It causes burnout and stress, and leads to people leaving the field, good people leaving the field. So.
Right.
Yeah, I think we all need to be a little bit more compassionate towards ourselves and each other, and just try to do the right thing. And it's hard in the middle of the chaos to take that breath and recenter, but these techniques are helpful.
And it does speak to sort of an earlier piece that we were talking about. It's about when that, right, we described a parent who is doing something. We oftentimes hear from parents about staff, and it's about having grace for another person and understanding where they're coming from. And as Shai has done all of this work, one of the things that he's understood is the kind of grace that the Head Start Collab directors have, that our Childcare Development Fund directors have at a state level, that folks on the ground in the trenches, there's very vivid imagery about blood and garbage, but the idea that people who are doing this work, we all have to have grace for one another. And that pause sometimes allows you to have some grace. Like, I'm so frustrated with this person could turn into, why am I frustrated with this person, and what can I do that may shift this? Again, it's where a consultant can be really helpful because they're engaging in that reflective practice with you and helping you get better at it. But I think that reflective piece is so critical for everyone in our field.
I love it, yeah. And sometimes it takes that external audience to kind of cut through the the drama and say, hey, what's really happening here? Or have you thought about this or that?
And it's reframing too. We spend a lot of time. I'll give credit to a person from New York State who basically told me, look, we talk about challenging behaviors as a term. I don't like that term. The behaviors are not challenging. We are being challenged by them because we are not well equipped to deal with them and to treat that behavior as communication and listen to what it's telling us. Now, I know that, if you just had a chair thrown at you, that's not very helpful. But I think that as a stance to adopt and as something to aspire to and as a capacity that we are trying to build, I think that's supremely useful to have as a perspective.
I love it, Shai. I've been struggling with that term. We do sessions at conferences, and it's like everyone wants the challenging behaviors or whatever session, but I haven't really liked that term either because I don't know that that captures the whole essence of what's going on, and I don't want to, be dismissive or do a disservice. But um, so they don't like the term. Did they give you any recommendations on what we could call the term? We should label this as.
Unfortunately not. We agree that
Okay.
we will keep talking. By the way, we don't love the term infant and early childhood mental health consultation. I mean, that is a handful. That is not very catchy, but I think that on the list of things to do, that's probably pretty low,
Yeah.
right?
Right. Right.
Let's build the workforce. Let's keep children in classrooms. Let's keep educators in classroom, and let's try and get this system thriving again.
Well, gentlemen, I really appreciate all you're doing. Thank you so much. I'm super excited about the cohort, and I hope you just blow the doors off the place and have a big waiting list. I think you probably will. Please, stay in touch. Let us know what's going on. If folks want to learn more about all the great work you're doing, what's the best way to stay on top of all the work at Georgetown?
Yeah, the best way is just hit up our website or just Google Thrive Center at Georgetown University. It's all there. We have multiple programs. We have the practical consultation program. We have a strategic program in consultation that's about systems design. So if you're trying to design a system of supports like this WNC Source in North Carolina have done, then consider joining that as a leader. Multiple other programs and ways to get involved, and this is only the beginning. I think what Matt Beal and his team are doing, our team are doing with the Thrive Center, it's probably moving at a pace that's X10 what you would typically see, and it's very much needed in this environment. So, yeah, thrivecenter.georgetown.edu. Come check out our training and education, and find ways to connect with us, and we'll be there for you.
Wonderful. Well, Neal, I'll give you the last word. What do you want to say as a parting shot to everybody here?
Yeah, no, I appreciate it, Andy, and I appreciate what I just laid out. Of course, people can just email me, which is also what happens is, hey, I heard this. Can you help me? Which I'm happy, Horen at georgetown.edu. But I appreciate what you're doing for the field, which is opening up conversation. I think this is what we've learned in the work that we've been doing in our national scan and the work that Shai's done for us around talking to folks across the country is the more we're talking about things to this question about what do we call it not being attuned. I'm going to go back to that. We're not in sync. If we're not in sync, it goes back to basic principles of what are we even disagreeing about? And I think that the more our field lays these issues out around behavior, around enrollment, around retention of staff, all those kinds of things, the more we're in dialogue about it, the more likely we are to get to better solutions, which we think we have a small piece of that. I think there's more out there. I think conversations that you're leading like this are incredibly helpful to the field. So just appreciate what you're doing as well and
Oh,
appreciate
well,
the
thank you.
opportunity.
The challenge is there's so much cool stuff going on, but we don't always have a chance to get together or hear about it. You would think in 2026, with all the communication tools that we have, we'd be more in touch and in tune with everything. But unfortunately, it's such a large megaphone now that it's hard to filter out what's noise and what's actually, happening. So I'm very happy to showcase innovation. We just had the governor's office from New Mexico on the podcast. That was amazing to see the great work they're doing in New Mexico. And hopefully other folks will take notice and learn more about that. But certainly, Georgetown, you guys are again moving mountains, and I appreciate all you're doing. So thank you very much for being here. I look forward to seeing you hopefully in person one of these days again. We'd love to have you come down to Head Start East in Puerto Rico in April 2027, if not sooner. But yeah, thank you guys both for being here. I appreciate it. And thank you, of course, for joining us here. We appreciate you listening to the podcast and hope that you got something out of today. I know I certainly did. So I will leave it there and say thank you for joining us. We'll see you on the next Early Childhood Chats podcast. For now, this is Andy saying stay safe out there.